Hi, good morning, everyone, and welcome to today's presentation. This is Oraposium 39, sorry, and it's refreshing to be here again. My name is Ogechukwu Charity. I'm a fellow Orapo College of Scholar. I'll be your moderator for today. And if you've shared a flyer for today's presentation, thank you. And if you've not, you still have time to do that. Remind people online about the presentation. Thank you very much for joining us this morning. We go ahead to do a formal introduction of who we are before we proceed. This is Oraposium, brought to you by Orapo. Orapo is an international independent oral and public health information, education, and research organization. Can anyone hear me? Hello? Okay. This is Oraposium 39, brought to you by Orapo. Who are we? Who are Orapo? Orapo is an acronym for Oral and Public Health. Orapo is an international independent oral and public health information, education, and research organization incorporated in the Republic of Gambia. Orapo exists to give underserved populations swift access to information, education, and research in the underserved areas of oral and public health discipline. Our mission is to support the development of oral and public health manpower, services, and consumer products in resource-limited contexts by catalyzing aggravated access to information, research, learning, and innovation in underserved disciplines of oral and public health. We have 5 entities in the Oracle family that work in synergy to execute the mission of the organization. These entities are treated separately. These entities include, we have the Oracle School, we have the Oracle Journal, we have our academic repository, we have Oracle College of Scholars, where the members are the one doing the presentation this morning. We have the Oracle Press, we have the Oracle Store. I apologize for my voice this morning. we have so many things that are available for your consumption, so you can do well to check on our services using www.oracle.org. Okay, and at our school we have affordable and flexible short courses that you can take for 2 to 3 months, 3 to 4 months, depending on the course. We have our mini master program. We have on other dental facility development and management programs that will be beneficial to you and your practice. For those of us in the dental practice, we have the Orapo community, where we are hosting Oraposium, where we host and discuss with health professionals in different fields. We also have the College of Scholars, or the Oracle College, where we have students and members of the college. We also have the fellows, because the first fellow, we've already graduated the first members who are currently the fellows of the institution. So do well. If you have any confusion, if you want to be enrolled to become a member, do well to notify us and or check our website, like I mentioned earlier, www.oracle.org, and follow the prompt. Thank you. So this morning, we'll be speaking on routine oral hygiene in oral health promotion. Routine oral hygiene in oral health promotion. And this morning we'll have one of our members, one of the member Oracle College of Scholar will have her speak to us. She's a dental technologist, an oral and public health scientist and promoter. She has earned mini masters in dental in dental practice, in dental public health from Oracle, and she's also a member of the Oracle College of Scholars. She's currently the CEO of Roselle Smile Dental Lab in Anambra State, the first dental facility in the history of her hometown. She specializes on dental care and restorative treatment to help restore the smile, function, and confidence of people. Let's make welcome our presenter for today, Ms. Ogechukwu Orji Roslyn. The floor is yours, Oge.
Good morning, everyone.
Good morning.
Having been presented by the moderator, I wish to go ahead and give my
Proceed.
presentation. Please, if by any way you aren't hearing me or I was lost by the network, please do well to call me back. Thank you. The topic I'll be presenting for today says routine oral hygiene and oral health promotion. Presentation outline. Introduction. Routine oral hygiene. Considerations for routine oral hygiene. Routine oral hygiene measures. Importance of routine oral hygiene and oral health promotion. Conclusion and references. Introduction. Oral hygiene deals with the maintenance and control of the amount of bacterial plants deposited on the hard surfaces of teeth and the mouth. Thus, maintaining good oral hygiene is vital to a sound general health. And oral health promotion actions help to improve oral health. Oral health promotion involves the combination of oral health education and legal, fiscal, economic, environmental, organizational, and technical interventions targeted to improve oral health and prevent oral disease. Routine oral hygiene. Routine oral hygiene is the main element in the prevention, control, and treatment of oral diseases. The early stages of teaching and practicing good oral hygiene start from a young age. These stages are followed by numerous pieces of information passed from parents to their children to achieve the child's perception of the role of proper oral hygiene, which follows to adulthood. The likelihood of older people maintaining a healthy functional dentition throughout their lifespan depends on their ability to perform daily oral hygiene care and also accessing professional maintenance services. You will agree with me that routine oral hygiene, this is a daily activity. This is something we do every day. Why do we do this? It is to improve our oral health. And this knowledge of routine oral hygiene or knowledge of oral hygiene, this is passed primarily from a professional to the parents, most especially mothers when they are pregnant. And then when now the, the mother gives birth to the child, she now starts to take care of the child's mouth. First, the mother starts from using a clean towel. You can bring out one and make it specifically for your child. You say, yes, I will be using this to take care of my child's mouth every day. Using it to swab the gum and clean the tongue. This is to remove all those sugars and milk that may have stuck to the child's teeth. So now, doing this from that infancy stage will now follow into the child coming up, let's say the age of 3 years, when there must have been a tooth eruption from the mouth. Through the guidance of the mother herself, she will help the child in taking care of that tooth until this child is now of age where he or she can be able to take care of his or her teeth by herself, following the instructions and guidelines that must have been passed from the parents, most especially the mother. And now it is now important that this action, a child will now have to take it into adulthood. And when he or she takes it into adulthood, it will now lead down to when the person will get to an older stage in life. And you believe me that when these practices are being done routinely, are being done every day, such will promote oral health and improve the oral health of that individual, be it a child, be it an adult, be it an elderly. To maintain good oral hygiene, some oral care products are used because of the increasing and improving technology in dentistry. A good number of these products are made accessible in the market, and different techniques will affect the choice of people, which are vital in promoting oral health and avoiding dental problems. Oral hygiene can be promoted in children, adults, elderly, and the community at large through improved oral health care programs and education, accessible oral health facilities, affordable services, and encouraging oral health habits and practices. There are varieties of products in the market which are made by different manufacturers, ranging from toothbrushes, toothpaste, and other dental aids that will aid in improving the oral health of a person, be it a child, an adult, or an elderly. So, when as a person you have knowledge of what oral health is all about, that this I need to do it to improve my oral health. This I need to do in order to avoid oral problems and some oral diseases from my mouth. You will go into buying or possessing one of these aids, being it known to you or having the knowledge that this will help to improve your oral health. In the community, oral health can be improved through oral health programs, even starting from a school. Oral health topics can be included in the curriculum of school children. Let's say in health education, in social studies, where they talk about basic hygiene, oral hygiene can be included in it. This is to help to impact knowledge of oral health into the child, which he or she will need to practice, which he or she will have to practice. Also, as a professional, you might go into the community and then arrange a dental health program for the community. You might get sponsors or you might decide to do it for free. The essence is to impact knowledge into the people. This knowledge, when they now put it into practice, will help to promote their oral health. Also, having an accessible oral health facility where individuals can walk in to gain knowledge concerning their oral health, or if they have one or two issues bothering their oral health, they can go there and access care. Also, this care needs to be made affordable and easily accessible by them. Also, by encouraging healthy oral health habits and practices, this will help to improve oral health. Considerations for routine oral hygiene. for the population at large to have effective oral hygiene for improved oral health, the following should be considered: health or oral condition of the individual. The World Health Organization made us to know that health is the state or complete of mental, physical, social well-being of an individual, and not merely the absence of disease or infirmity. In which case, a disease can be there, but how do you go on to handle it? So, health is a consideration for routine oral hygiene. Good health helps to improve the livelihood of a person. Therefore, the health of an individual will help him to live a good life and a healthy lifestyle in order to be free of certain oral diseases. But then, if this individual does not consider his or her health or her oral health and start practicing some bad oral habits that will be detrimental to his or her health, that poor oral habit needs to be called to order or needs to be curtailed by when this patient is being given some basic tips or some basic education that will help to improve his or her life. Also, age of the individual is a determinant or a consideration. Take, for instance, in babies or in infants, they themselves cannot carry out oral hygiene by themselves. So, considering their age, someone needs to guide them. Someone needs to guide them in order that their oral health will be improved. It is a consideration, the age of an individual. As a parent or as a nursing mother, you need to care for the mouth of your child, ranging from their gums to their tongue. This will help them to become familiar with that feeling of their teeth cleaning. That when they grow or as they are growing, they themselves will be able to carry out these instructions or these practices by themselves. Therefore, age is a consideration in elderly who are aged and can or sick and cannot carry out, let's say, a routine toothbrushing. A caregiver can be assigned to them in order to help them to carry out these practices. Age is a consideration. Another one is oral hygiene products. You have to consider the type, the nature of the oral hygiene products that you are using, as this will help to improve your oral health. Therefore, if you do not consider it and go into making some wrong choices, it will mar your dental health and make you prone to oral diseases. Therefore, the oral hygiene products that one is using needs to be assessed. Needs to be assessed. If, as an individual, you don't know the right toothbrush to use, ask someone that has the basic knowledge. Ask a professional. Visit the dentist. Tell him, please, what kind of care product, what kind of toothbrush, what type of toothpaste can I be using? I believe the professional will guide you and tell you the right one to use. Manual dexterity. When you talk of dexterity, dexterity deals with skills, and these skills are often performed with the hands. In children and also in adults, dexterity plays a vital role and should be considered for routine oral hygiene. Dexterity helps to improve the dental health. As your dexterity improves, let's say the firmness of how you grip your toothbrush, the tactfulness of how you brush. You don't have to vigorously brush in order to damage your tooth structures. You do it gently in order that those bristles can dislodge all those food particles. So dexterity needs to be considered. Lifestyle of the individual. For a routine oral hygiene, the lifestyle of an individual needs to be considered. What do you mean by lifestyle? Lifestyle deals with way of living. Lifestyle is quite different from culture, but lifestyle can either be influenced. Yes, I have seen in a situation whereby someone is not a smoker, but because he moves with people that smoke, he tends to learn such lifestyle and then start practicing it. So the lifestyle of an individual should be taken note of. It should be considered for routine oral hygiene. As a smoker, the way you take care of your mouth should be quite different from the way a non-smoker takes care of his or her mouth. This lifestyle of an individual can either mar or improve his or her dental health. But I believe when the necessary education is given to this smoker, he or she will tend to amend his or her ways, and then his oral health will be improved. Motivation. Motivation deals with needs, desire, or drive. So you need to consider what motivates this individual, what motivates this child to indulge, let's say a child that some sucks. As a mother, you need to find out, is it hunger that leads to this child sucking his or her tongue? Is it that he wants to pass an information to me? When, as a parent, you check properly and be able to communicate this child's needs, you tell him that my my child, this thumb sucking is not good. It will affect your dentition. So when you are being able to take care of the motivation of the child or a person, you have to it is a need for consideration for routine oral hygiene, because when such child drops such habits, the the oral health of that child will be preserved and being promoted. Routine oral hygiene measures. Toothbrushing with fine designs continue to be modified by manufacturers. These modifications include round-ended bristles to improve efficacy, small size heads for better access, and longer handles to enable firm grip. One needs to make choices from manual and electronic toothbrushes, soft, medium, and hard bristle toothbrushes. In the market today, there are increasing products, oral health care products in the market. Very many manufacturers are making their oral hygiene products and pushing it into the market. And it is important that as an individual, you have to know the type of the oral healthcare product in the aspect of toothbrushing and toothbrushes and toothpaste, in order that your oral health will be improved. Therefore, there are ranges of types of toothbrush. You have the manual one, you have the electronic toothbrushes. Then these toothbrushes, they have their bristles, which are either soft, which are either medium, and some are hard. So it is good that as an individual going for purchase of toothbrushes, as a child, you have to go for a soft toothbrush. As an adult, you go for a medium sized toothbrush. The hard toothbrush is not really advisable for one to purchase in the market and then start making use of it. But for some denture wearers, they can make use of that hard toothbrush in order to keep their denture clean. You have to brush at least twice daily. You brush in the morning and you brush at night with a pea-sized toothpaste. Make sure that this toothpaste you are purchasing that it contains fluoride. What the fluoride does is it helps to decrease the bacterial functions in the mouth. Those bacteria that act against your teeth and make them prone to tooth decay. Fluoride helps you to tackle them, and then it makes your mouth to be healthy and good. That when you talk, that when you talk, people will not run away from you. While brushing, there is what we call an ideal toothbrushing technique. You have to place your toothbrush at a 45-degree angle towards your gum in order to sweep away food debris and plaque from the gum line. Flossing and flossing aids. Flossing regularly at night with the aid of a dental floss is the most effective means of removing interproximal plaque and reducing gingival inflammation. It is an important oral hygiene habit as it cleans and dislodges food particles from the mouth. Many people do not know what dental floss is all about. A dental floss is an oral health care product. It is used to dislodge food particles, to remove food debris that are stuck in between the interdental spaces of one teeth to another. And it is advisable and ideal that one needs to floss daily. It should be done the last thing at night before one goes to bed. Use of sugar-free chewing gum. Sugar-free chewing gum, chewing a sugar-free chewing gum at least 20 minutes after eating help to reduce the fall in the plaque pH. That is the acidity and alkalinity of the mouth. That's when we must have eaten. It also serves as a salivary stimulant, which helps to accelerate clearance of dietary substances. A main component known as xylitol is a source of energy, which is absorbed more slowly by the body. It also helps to prevent tooth decay and plaque buildup. So it is advisable, not that you go on to chew gum every day and every day, but when you want to chew, buy the one that is sugar free, that contains xylitol, which can be easily assimilated and broken down by the body. And also, it helps to freshen your breath and keep your mouth good. In order to avoid mouth odor E. coli, this chewing of sugar-free gums helps to facilitate that. Reduction in the intake of dietary sugar. Consuming of free sugars increases the risk of dental problems such as tooth decay, and excess fat from food and drinks high in sugars contribute to unhealthy weight gain. Thus, a reduction in the intake of dietary sugar is necessary to overcome these health and oral health issues. You know, one of the measures of routine oral hygiene is reduction in the intake of dietary sugar. There are people that have made it a habit that a day will not pass without them consuming bread. Yes, bread is good. It is good to eat, but then you have to limit your intake of it. Chocolate, giving children chocolates every day, giving them sweets, giving them all manner of sweet drinks. You have to curtail it because they if it is when you are consuming this every day, it increases some high risk of environmental problems, most especially tooth decay or reduce your intake of all these dietary sugars so as to be on the safer side. Adequate drinking of water. Water should from the mouth and less often at night to limit frequent urination. Water, they say it goes that water is life. So it is good for one to consume lots of water during the day. At least whenever you eat, after eating, make sure you drink. You drink water so that the water will flush down the food into your system. If there are any food debris in the mouth, the water equally will wash it away. Mouth rinses and mouthwashes. Antibacterial mouthwashes and mouth rinses help to keep harmful oral bacteria at bay. It washes away food debris and reduces plaque buildup. An alcohol-free formula is good to prevent dry mouth. The use of mouth rinses and mouthwashes is one of the measures of routine oral hygiene. But then many people have made it a habit that they now they now substitute toothbrushing, even flossing, with use of mouthwash. No, that is not meant to be so. You have to brush, you have to floss. After you might start to just use a little of it. You might dilute it in water and then use it to swab your mouth, you gargle your mouth, and then you are good to go. You don't have to substitute toothbrushing and other oral hygiene measures with mouthwashes. And when you want to choose a mouthwash, please choose an alcohol-free formula. If you can't get it on your own, ask a professional to tell you which one is the best one to use. Then go for it, buy it. This helps to prevent dry mouth, and also it helps to prevent mouth odor. Eating balanced diet. Oral health, diet, and nutrition are closely linked. Therefore, eating a balanced diet helps to preserve oral health as the body assimilates the nutrients which are beneficial to one's overall health. Poor nutrition can lead to some oral diseases like mouth odor, tooth decay. So it is advisable that one has to eat a balanced diet. It's not every time you go on the consumption of carbohydrates. Try and balance it. Even if you don't have any other food around you, vegetable is there for one to consume. It is good. Egg, you can take egg once in a while. All this helps to provide the nutrients for the whole body and also to improve one's oral health. Consumption of fruits. Eating fruits like apple, watermelon, cucumber help to clean the teeth naturally. And vitamins from them aid healing, especially gum from gum diseases. We have other fruits, the fibrous fruits. We have the cleansing fruits. Even there are some fruits that are sticky. Take for instance, banana. Banana is sugary, it is sticky. It is good to consume, but you don't have to constantly consume it every day. Make sure that when you consume banana, that you use water to wash it down. Lime, you don't need to consistently consume lime. Lime is abrasive to the teeth, and also it can lead to the teeth sensitivity when being consumed all the time. So you have to eat more of fruits, most especially the ones that clean the teeth naturally. This sub this gives the nutrients that aids healing, so that when you have any injury in your mouth, let's say you're having a gingivitis, inflammation of the gum, the nutrients derived from this fruit consumption will help to combat such oral disease and promote your oral health. Visit to the dentist every 6 months. A routine dental check is very necessary, at least twice in a year. This helps in early detection of oral health problems, and preventive treatment will be given. Visiting the dentist twice in a year is one of a routine oral hygiene measure that one needs to uphold. You don't have to say that I don't have any dental issue. Like some patients I've had them say, they'll say, no, my mouth is good though. I don't have any tooth problem. So I don't need to visit the dentist. They only find it useful to come whenever they are having a pain or any form of a dental problem. But no, that is not meant to be so. You need to visit dentist twice in a year. This is to help to detect some oral health problems that one is having. Let's say for someone that have a pit or a fissure in the teeth, a small pocket in the teeth, you know, it may not be painful, but during the routine dental change, let's say in the course of scaling and polishing, such can be detected and a fissure sealant can be applied there, let's say in children. And if it's a cavity that is small, it can be filled at that initial stage for it not to start expanding. This is so visiting the dentist every 6 months is a routine oral hygiene measure that one needs to adopt. Importance of routine oral hygiene. It promotes early detection of oral diseases. When you visit the dentist at least twice in a year, there are some oral diseases that can be detected or oral problems. Let's say in a child, because there are some children, their new teeth will not fall off before the emergence of the permanent tooth. That if left there, it will it will lead to malalignment of the child's teeth. But when this child is being brought to the dental clinic or dental facility, such can be detected and a care given of those children that have the caries owing to their consumption of different sugary stuffs or sweeteners. It's a routine oral hygiene will promote the early detection of these oral diseases, and the necessary care will be given. It prevents tooth loss. Yes, One of the leading cause of tooth loss is a dental gingivitis, is a periodontal diseases, not gingivitis, periodontal diseases. So these calculus that are being formed along the neck of the tooth between the gum and the tooth can lead to tooth loss. But a routine one of the importance of routine oral hygiene is to prevent tooth loss. So when you take this child or this individual for routine dental check, and then some like teeth cleaning carried out on this patient, it will prevent tooth loss. It decreases mouth odor while promoting fresher breath. Brushing every day, intake of water, and even the chewing of the free gum can help to decrease mouth odor and promote a fresher breath in an individual. It is an importance of routine dental care because and acts such as the toothbrushing is what we carry out every day routinely. So it helps to decrease mouth odor and also promote fresher breath. It provides relief from dry mouth. It provides relief from dry mouth. And consumption of water adequately every day will help to suit the patient's oral health and thereby decrease dry mouth. It boosts self-confidence. When you have a healthy, when your teeth are intact, when you are free of oral diseases, owing to the fact that you religiously carry out your oral hygiene measures, it will boost your self confidence and enhance your smile. A healthy, attractive dentition is a key factor for employment. Someone can be employed because of his or her dentition. Yes. Let's say a tooth, a close-up company, or not close-up, a toothpaste manufacturing company can see how good a dentition of a person is, how attractive it is, and may decide to use that person for an advert. And believe you me that when this is done, that person will earn from it. So, one, practicing good oral hygiene. It is a ticket for such person to land a job. It preserves tooth structures, your gum, your mouth, your tongue, your rugae, your soft tissues, even the hard palate will be preserved once you practice and maintain this act of routine oral hygiene. It also promotes lower risks of heart disease, stroke, diabetes, and other health conditions. Conclusion: oral health skills are best acquired during childhood. If learned and maintained, they become established habits and are less likely to change. Parents, especially mothers, play an essential role in the development of good oral hygiene habits of their children. Children, parents, and the population must be made dentally aware through basic oral health teachings by dental professionals. Effective delivery of oral hygiene measures, when combined with effective motivation, will improve and promote oral health. These are my references. Thank you.
Thank you very much, Ogi, for that insightful presentation. For those of us in the dental industry, I believe this is an enlightenment to the knowledge you previously had about routine oral hygiene in oral health promotion. Thank you once again, our presenter, for doing justice to the presentation. So, right now it's time for questions. If you have questions pertaining to the presentation of today, the time is now. You can also drop your questions in the comments section, and we'll respond to it as soon as possible. We have just few minutes to do this while we are at it and waiting for you. For those of us joining us for the first time, if you're here for the first time, this is Oracle Community brought to you by Oracle. And we are glad to have you around us today, and we hope to see you in our next presentation. Okay. If you have your questions, your commendation to the paper presentation, please go ahead and signify, and you'll be allowed to speak. You can also drop a text in the chat box, and you'll be allowed it to be read, and the question also will be notified to the presenter. But most of us here are dental health practitioners, so I believe that this is not a new topic to any one of us. And let's appreciate the presenter. Since if you don't have a question, at least for giving out her time, dedicating her time, and researching to get these resources available to us. It's really thoughtful of us to appreciate her for that. If you also have a contribution to make, please feel free to contribute to the paper presentation. But let's take note that no corrections to the paper presentation is allowed. Can anyone hear me?
Hello, yes, good morning.
Okay.
Hello, Charity. Well done for the beautiful moderation.
Hey, Jesse.
The presenter, she did really well. I don't have a question. I got reminded of one or two things in a practice as dental professionals. I want to commend her and encourage her. I hope that further presentations or other presentations are more beautiful than this one. Well done. Thank you.
Thank you very much, Jessica, for that commendation. You're still waiting for us to respond to the presentation. If you have a question, please feel free. If you want to contribute to the topic, please go ahead. Please go ahead and make your contribution. We have just few minutes remaining, 8 minutes, and we are done. Okay, while we're waiting for those typing in the chat box, we want to especially appreciate our lead mentor, the one that gave us this platform, an exceptional prof. Thank you very much, Dr. V.E. Adamo, for bringing us together as one family in this Orapo community, networking and meeting new people every day, learning and gaining new insights on each topic of presentation. We really appreciate you, sir. And we pray that we'll become greater and bigger, and this vision will not die, rather it should grow. It will grow. Amen. Thank you very much, sir. Okay, while we're waiting for those of us that are typing, Did you actually do computer? It seems as if the message you want to drop is a long one. It's a long one. Okay, let me appreciate the fellows in the house for joining us this morning. I can see you, Mr. Samuel. I can see Mr. Raphael. Thank you for joining us this morning. Also appreciate um Mrs. NIF Enojo for joining us this morning. Jessica, Promise, Johnny, Ahmed, Ogi. Who else am I missing out? Okay, Ogechukwu Promise said nice and detailed presentation. Thanks to the presenter. Thank you very much, Promise, for your contribution and commendation. Thank you. I can also see Cynthia in the house. Cynthia, you're welcome. Thank you for joining us this morning. We hope to see you in the next presentation. So please don't forget that as soon as we are closing up, it doesn't mean that the community chat box is going to be dormant. Please engage the questions that will be dropped there. And the presenter keep an eye to keep an eye on the messages that will be coming in case if you have any questions coming in from sorry, any member of the community. Thank you very much, every one of us, for joining us this morning as we are rounding off already because it seems that the topic of presentation today is well digested, well understood. Well, we are all dental professionals. This is just let's say it's a refresher's course on routine oral hygiene. So thank you, everyone, and we hope to see you again. Bye.
Bye.